Hey all, good evening, and this is Dr. Rohini here, and last session for today, and we going to discuss some mixed match again, mixed match anatomy series, and this is especially very important for all those who are taking the exam recent. So here we are going to see some MCQs, we are going to see some image-based questions, and we are also going to include some PYQs. So all this is going to be mixed of many things. So here, let's go ahead and start with the introduction and then move on to the questions. So here it is, and little of my credentials. MD from KMC Mangalore, that belongs to Manipal Academy of Higher Education. Then as you can see that I have multiple degrees, PhD from Savitha University, and I also have medical transcription and MBA from Hospital Administration from Georgia, that is in Atlanta, USA. So here, I should also mention that I have worked for about 9 years in USA, and that is at a hospital by name Rockingham Memorial Hospital. So with all these credentials, I would also like to say that I'm a good counselor, student counselor, and if you have any questions or queries, not just regarding the subject, anything else, you can always join my Telegram Anatomy by Dr. Rohini and we can discuss and take it through. All right, so here we have some of the dedications from the students who have been actually benefited. So without those, students being benefited, it wouldn't have, all these good words wouldn't have come, right? So here is some of the nice words for me, and I really get motivated by all this. And what is your motivation to stay focused on your studies? Let's see what else we have. Telegram channel, that is Let's Crack NEET PG. And this is definitely going to be very beneficial to you because you are going to join this channel, and not just anatomy, you are going to get all other subjects access. So you can get PDF notes, and sometimes the educators would upload the questions and MCQs, PYQs, and many things, all that you can have access to by joining this channel. And you can also see there are special classes on Wednesdays, and these Wednesday special classes are really nice because it starts as early as 7:30 in the morning, 7:30. So all that you can see. So you also can see that special class features are really different because they're more interactive live classes. And you can also see that we have polls for learners. And there is a feature called raise a hand where students can raise their hand, ask questions, and you will also never miss the class because you're also getting the notifications prior to the class. And all these lecture notes you can have access to in the form of PDF at the end of the class. All right, so here is the referral ROHINI 10. Use this referral code and also get 10% discount when you go for subscriptions. So subscriptions are really interesting because they cover the complete curriculum. Unlike your YouTube or special classes, the special class is going to give you a glimpse of what exactly you can look for in the actual classes. So just go look out for what subscription options you have. We can give you little bit of hint and help with that. Plus subscriptions, you have access to live and recorded sessions, and you can also get printed notes when you go with this subscription for 12 months and above subscriptions. And you can also see Iconic has not just an academy but also Prep Ladder access. So both access you have. And you can also see there is NEET 1 month package. And this, if you unlock, you have lots and lots to, look forward to because this is going to give you grand test series also included in this. So this is 1 month package. And you also have 25,000 plus high yield clinical questions access, that is updated and highly effective question bank, that is. And you can also see there is boost your medical PG with 12+2 offer, and also 4 year subscription you can go for when you want to have a smooth transition from UG towards your PG. Okay, so that is something you can go for. This is 60,000 and it's going to be 75 with the iconic subscription. And you can see that there is 48 months, subscription is going to cost you just 1250, and also 48 months iconic is 1406. So all this is going to be just with the code ROHINI 10. Okay. Here is some information and let's move on to the actual, interesting things. What is it? So here is the development of the tongue. So development of the tongue is actually very interesting because you have many components that make up the development of the epithelium of the tongue. So here is the epithelium at 4th week of gestation. So it is from the 4 pharyngeal arches 1 to 4 all are involved. First one, second one, third and fourth. So here you can see the lingual swellings. These are the lingual swellings. And you have tuberculum impar. This is the tuberculum impar. Then you have a small foramen cecum. That's what comes down into the neck and forms a diverticulum. That is thyroglossal duct formation. Starts there. And then you also have hypobranchial eminence that gives rise to cranial and caudal part. They also give rise to the root of the tongue and also to the posterior 1/3 of the tongue. The cranial part gives rise to posterior 1/3 and caudal part gives rise to root of the tongue. And you can see the lingual swellings on either side. They fuse in the center and they also leave a sulcus called a median sulcus. Now, this is about the development. What about the muscles? Muscles are from the occipital somites, or you can also call them occipital myotomes. So let's look at some of the questions now. Now, the question says tongue develops from. So here they have not given you the pharyngeal arches. They have only talked about the mesoderm of the pharyngeal pouch. They have talked about endodermal pouch. So they're definitely talking about the muscles. So now here occipital somites is the answer. The answer here is A. So A is what is going to be the answer because tongue develops from A. All right, let's go to the next one and see what we have. Let's see if there is anyone who has anything to suggest or ask. Next one. Two muscles in the middle ear. You know that there are two muscles in the middle ear. There is tensor tympani and tensor veli palatini. Right? So these are the muscles that are supplied by. All right. Tensor tympani is one muscle that is present in the middle ear. Then we have another muscle that is called the stapedius. Stapedius actually, it helps in reducing the noise that travels to the middle ear. Okay, so this is supplied by the facial and the tensor tympani is supplied by the nerve to medial pterygoid. And this is a branch from actually the mandibular. So you can see the muscle here, very beautiful diagram. You can see the muscle in the middle ear. You can see the malleus, incus and stapes. This is the malleus, handle of the malleus. And you can see the incus and the stapes there. And look at the stapedius muscle, how tiny it is. It is one of the tiniest muscles that you can see. And it is supplied by facial nerve. So this is it. And this is the another one. Tensor tympani. Okay. Next, see the question. So now here, these are the two muscles. The question would be what the nerve supplies are. So now one is supplied by the mandibular branch. The other one is supplied by the facial nerve. So here, tensor tympani actually arises from the cartilaginous part of pharyngotympanic tube, which is very close to the sphenoid bone, and it is attached to the handle of the malleus. So you have to remember which one is attached to the handle of the malleus and which one is to the stapes. So one is to the stapes, another one is to the malleus. The one to the malleus near its root is the tensor tympani. Okay. Next, go to the question where it says about the trapezius. All are correct except the incorrect statement. One incorrect statement you have to pick. Which one doesn't hold good? So now here they say it arises from the lateral two-third of superior nuchal line. Its lower part is inserted into tubercle on the spine of the scapula. That's correct. It is supplied by spinal accessory. That's also correct because the other muscle supplied by spinal accessory is sternocleidomastoid. And its upper fibers help in shrugging of the shoulders, correct? And the middle fibers, what do? They help in retraction. And lower fibers help in depression. So that is the action of the trapezius with three set of fibers. Now, all the statements seem to be correct except for one. That is, it is not attached to lateral one-third. It is attached to the external occipital protuberance right in the center along with the ligamentum nuchae. Okay, these two together. Next, this is how it looks. You can see the upper fibers, what is their action? The middle fibers, retraction. Lower fibers will do depression. Very, very important. And you can see they're all supplied by spinal part of accessory. And this is the origin and insertion. Insertion is to the scapula. Let's go to the next one and see. Here the question is about the carotid sheath. What is the relevant statement that you can pick regarding the carotid sheath? Now, carotid sheath, regarding carotid sheath, it extends from the base of the skull to bifurcation of common carotid, contains stylohyoid ligament, contains only three cranial nerves. It is attached to the aorta, contains the sympathetic trunk. Okay, the carotid sheath extends from the base of the skull to the bifurcation of common carotid. So it is not from the base of the skull. So you can't say base of the skull. So here you have to remember it is attached to the aorta. It contains the sympathetic trunk. It contains the stylohyoid ligament. It's wrong. Only three cranial nerves. No, it contains only vagus. Then it is attached to the aorta. It is not attached to any of that. It contains the sympathetic trunk is correct, I would say. That is the relevant statement. It extends from the base of the skull to the bifurcation of common carotid. No, it is the other way. The extension is the other way. It is modification of the deep fascia. So it is not from the it is not from there. So here the relevant one is E. Next one. So now here you have the contents. You can see internal jugular vein, common carotid, and you have the other internal carotid. So along with that, you can also see the vagus nerve. This is one of the content. Okay. Next, regarding the vertebrae, let's see what is the true statement regarding the vertebrae. We have spinal nerves emerge through foramen between the vertebral laminae. Anterior longitudinal ligament extends from anterior tubercle of the atlas to the upper part of lumbar spine. Articular processes are joined by adjacent vertebrae. Ligamentum flava joins the spinous process. Now, this true statement we have to pick. The typical thoracic vertebra has foramina in transverse process. Not the typical. It is the no, not thoracic actually. It is the cervical. ligamentum flava joins to form laminae are the ones which are joined, not the spinous process. Articular processes are joined to adjacent vertebrae by synovial joints. So now let's see what is the answer. The answer is C. They are called zygapophyseal joints. So these are the ones which are like, attached to each other by those laminae and pedicles. Now here they have a facet above, facet below, and these are the transverse process, and you can see them, they are all attached by a special type of the synovial joint that is called zygapophyseal joint, that is between the articular facets. Next one, when performing a lumbar puncture, when we perform a lumbar puncture, the spinal needle should not pass through which one? So now there is a difference between epidural and lumbar puncture. Epidural, the spinal needle goes to extradural space. Extradural space. Because you want to administer some drugs that goes through the extradural space. And in lumbar puncture, you are reaching the arachnoid, subarachnoid region or space. Okay. When performing a lumbar puncture, the spinal needle should not pass through ligamentum flava, posterior longitudinal ligament, supraspinous, interspinous, or skin. Which one? It should not pass through. Okay, so now here let's see what is the answer. The answer is B. The answer is B. It should not pass through posterior longitudinal ligament. What does that indicate? It indicates that you have reached too far. So here you have the anterior and posterior longitudinal ligament, and this is the subarachnoid space, and you don't want to hit the posterior longitudinal ligament, and that indicates that you have reached too far. All right. All of the following are branches of external carotid artery except one. So you have so many branches. You have about 8 branches, and there is sister Lucy's powdered face. Often is not there, attracts, okay, medical students. Now here hypoglossal is the one which has not been called out. So that is the one which is not a branch of external carotid. So the answer is D. Okay. So lingual supplies the tongue, facial face, ascending pharyngeal will supply the tonsil and the pharyngeal region. Superior thyroid will supply the lobes of the thyroid, upper part. Okay, so now here you can see the branches of the external carotid. All the branches of external carotid are, they're all anterior branches except 2 which are posterior. So 6 are anterior, 2 are posterior. Next one, the alar ligaments, ala. Ala is something like nose sides. Okay, so ala is always sides or the lateral things. So they are the ones which connect. It's not in the center, it's on the side. So what do they connect? They connect bodies of the axis to foramen magnum. Is that the thing? Dens to the foramen magnum, vertebral bodies posteriorly. It is not the body at all. It is attached to apical and alar are the special ligaments only for the axis vertebra, that is second cervical vertebra. Okay, so you can see that there is dens, that's also called odontoid process of the axis. There is adjacent laminias option. There is tips of adjacent spinous process. Of course not. These are the ones which do not come into the category at all. So we'll see what is the answer. The answer is B. Here you can see apical, you can see alar, and see how it is attached to the foramen magnum. This is the questions that we had for today. I hope you liked and I hope you grabbed some knowledge through this. And here we come to the end of this session. And this is the 10 p.m. mix and match number 3. So we are going to have every day lots and lots of MCQs running in anatomy section. So please watch all my classes at various timings. One is definitely going to be at 10 p.m. daily. So please watch this and see you tomorrow, 7:30 with the new session. I'm going to be talking about something interesting. So please see me at 7:30 a.m. tomorrow, and also subsequent classes are present throughout the day. Okay, so you can also join the Telegram Anatomy by Dr. Rohini. If you have any questions, please post it. I will answer all your questions. And also, please answer all my MCQs and image-based questions and spot diagnosis that I always put up. So that is all for you to reach your goal sooner. Thanks for watching.